Hello everyone. I'm Dr. Sumina Reddy, fertility consultant and laparoscopic surgeon, Fertilica IVF, Hyderabad. Today we are talking about the importance of diet in reproductive health. In conversation with me today is Ms. Soumya, who is an accredited dietitian from the Australian Board of Dietetics. The conversation cannot be complete without talking about polycystic ovarian syndrome, which is so important and so very common in women trying for pregnancy. So as we all know, polycystic ovarian syndrome, or PCOS as it is commonly called, is a common hormonal imbalance condition where the periods are irregular. There is unnecessary weight gain or unexpected weight gain, along with unwanted hair, acne, and other conditions that come out of hormonal imbalance. So, in women with PCOS, what care should be taken in the diet that they take?
I think firstly, thank you for saying PCOS, because a lot of people still say PCOD. Yeah. So in terms of nutrition, right? So firstly, PCOS, like ma'am said, is a hormonal condition, and dietitians and gynecologists as well, we call it a lifestyle disorder. Yeah. So getting your lifestyle on track is one way to go forward with PCOS. So when we think of PCOS, there are multiple issues, like ma'am said, that come into play. The main issue I think would be irregular cycles. The other issues is inflammation on the inside. So inflammation presents itself as acne, as hair loss or alopecia. Male balding is what we call it in simple terms, as well as a lot of insulin resistance or acanthosis nigricans that presents itself. So dark patches on your neck, underarm, and your groin. Diet, there is no one solution that fits everyone. It has to be customized based on the symptoms that people are facing. Yeah. So usually for irregular periods, we focus a lot on inositols and myoinositols. So this is something we focus on irregular periods as well as insulin resistance. Inositols help with regularizing those periods and helps with balancing your hormones. When it comes to internal inflammation, so a lot of hair fall, acne, acanthosis nigricans, again, we focus on a lot of anti-inflammatory properties of the diet. So a lot of antioxidants, a lot of trigger foods as well. So dairy is one of the biggest trigger for women with PCOS. So we avoid those things. And again, I would say carbs is something that I would say people not to avoid. It does not have to be avoided. We just have to focus on whole grain, unprocessed, low GI carbohydrates, and adding a limited quantity of it in every meal.
Correct. And PCOS, as we know, the main pathophysiology behind that is insulin resistance.
Correct.
So how do we deal with this insulin resistance? Apart from the medicines we give, the metformin and the other drugs, anything that can be done in their daily diet?
100%. So insulin resistance is the stage before pre-diabetes. Okay. So that's why, as a rule of thumb, we tell women that if you do have PCOS, you need to be very careful, precautious now itself, because there are chances you could develop diabetes in the future. Yeah. So myoinositol is the first line of therapy. So I put any woman who's trying to conceive, or even if you're not trying to conceive, myoinositol is something that's part of their lifestyle. When it comes to diet, again, I usually ask them to follow an inverted pyramid kind of pattern when it comes to your carbohydrate intake. So the broader part of your pyramid is the carbohydrate amount you can have for the breakfast or the first meal of the day. Okay. As you go throughout till dinner, the carbohydrate content needs to keep decreasing. Okay. So the dinner is supposed to be the lightest in terms of carbs. So I would ask people to have a lot of protein and fiber for dinner to prevent that sugar spike when they're sleeping. Okay. So your body has enough time in the night to focus on fat loss, to focus on regulating hormones, rather than focusing on digesting that heavy meal you've eaten. So just by following this inverted triangle pattern of carbohydrate intake can help. And protein is something super important again. So start your day with a meal that at least has 15 grams of protein to help you get throughout the day in terms of energy levels, cravings, satiety, all of that. The first meal needs to have 15 grams of protein.
Correct. So this inverted pyramid is an interesting concept. So there's a saying also, I guess, breakfast eat like a king, lunch probably eat like a common man, and dinner eat like a pauper or a beggar, they say.
Yeah.
At least when it comes to carbs maybe, but
Correct.
protein you need to include in every meal, every
100%,
diet.
yes.